Of the many papers coming out of TCT 13 that will be published in the Journal of the American College of Cardiology, PEPCAD China ISR, a prospective multicenter randomized trial of paclitaxel-coated balloon versus paclitaxel-eluting stent for the treatment of drug-eluting stent, in-stent restenosis. And I am with Dr. Zhu Bo, who is from Fuwai Hospital and the National Center for Cardiovascular Diseases of China in Beijing. First, thank you very much.
Thank you.
Now, in this particular trial, we're taking a look at stents versus a balloon. Tell me a little bit about the process before we talk about the trial.
Actually, you mean the procedure before the randomization is to receive a drug-eluting balloon versus a drug-eluting stent. You need to prepare the lesion very well with a pre-dilatation balloon, regular balloon, or cutting balloon, and then the patient will be randomized.
So you have a patient who has a complete in-stent restenosis.
Yes, that is in-stent restenosis after drug-eluting stent implantation, Moran type 1 to 4.
So how these patients are stable, I take it?
I think most of the patients are stable in China.
So 220 patients were randomized in
Yes.
this particular trial, 1-to-1. Now, in this particular trial, what was the approach with, say, a long lesion?
If you look at the inclusion-exclusion criteria, you will find the lesion length will less than 30 millimeter. So if possible, we'll use one drug-eluting balloon to cover whole length. If impossible, we'll use two balloons to cover to make drug delivery.
Now, in this trial, what did you find?
This is a non-inferiority trial. The purpose of this study is to evaluate the safety and efficacy of drug-eluting balloon with a drug-eluting stent for treatment of DES In-stent restenosis. Actually, this is first randomized trial conducted in China. We're going to get approved by China FDA for the drug-eluting balloon. So finally, we found there's the non-inferiority primary endpoint was met.
What are the advantages of not having to put a balloon in when there's already a stent there that stenosed once?
People in China, physicians in China is facing this kind of difficult, although the introduction of drug-eluting stent make the restenosis rate much lower than before, but you already find some in-stent restenosis after drug-eluting stent. For example, diabetics and small vessel.
Right.
So, to avoid the double layer or three layers with a stent, I think the drug-coated balloon technology is a good option for the future, this kind of particular patient.
Now, not specifically how much drug is used, but in terms of putting the balloon in and then getting the drug to the vessel, is there a lot of pressure needed behind that or not much?
I don't think so. For example, if you want to implant drug-eluting stent, people intend to use higher pressure, get a stent opposed to the vessel wall. But for a balloon, just for drug delivery, you don't need very high pressure. In average, the pressure is 8 atmosphere in our study.
So in this particular trial, you've got it's non-inferior, so the balloon and the paclitaxel-eluting balloon and the paclitaxel-eluting stent. 220 patients. What's next? Are you doing a larger study? Are you following these patients?
Yes. Number one, I think we need to follow the patient for a long time. For example, 2 years, annually up to 5 years. Second, I think there's no big randomized trial with clinical endpoint in the world. After launch this kind of device in China, I think it's necessary to do a large randomized trial to compare not only for in-stent restenosis but also for other lesion subset.
Well, it's exciting, and I congratulate you on this presentation here at TCT.
Thank you very much.
And the paper itself, you can go to, Jack, because it is online, that is concurrent with the presentation here in San Francisco. For CardioSource World News, I'm Rick McGuire.